Sorry, parity of esteem between mental and physical health has been a lot of rhetoric from the government recently. What is going on to actually make that happen? Because as we've seen, there's still a long, long way to go before there is true parity.
There's a long way to go. We're far from achieving it. We should be very open about that. So there are lots of things that are happening, but for example, the mandate, now this is following the health reforms, this is the government's statement of its priorities for the health service. And the first one ever published last autumn gave mental health a higher priority than it's ever had before. And we required the NHS England and the Commissioning Board to make measurable progress towards achieving parity of esteem by 2015. And there's a legal obligation behind the mandate. We've also required the Commissioning Board to assess access to mental health services across the country with a view to introducing access standards. So in physical health, the previous government introduced an 18-week waiting limit. You have to be treated within 18 weeks of a referral from your GP. There's nothing equivalent in mental health at all. Why is that? So I want to introduce access standards in mental health as well as in physical health.
Okay, and will there be more investment in mental health to go along with this?
Well, hopefully next week we'll be giving an indication of some money earmarked, particularly for some mental health priorities. I've already made the point that I think we need to do far more to address crisis care to ensure that there's real parity of esteem there. The Schizophrenia Commission also made the point that we don't spend the money wisely. We spend too much of it on inpatient care and not enough of it on preventing a deterioration of health. So we must be much smarter about how the money is spent, as well as trying to fight for the sufficient resources in total.
So there's going to be more emphasis on recovery as well, you mentioned?
Absolutely. I think too often the ambition is limited for people. It's just maintaining their condition, whereas actually the whole emphasis should be on helping them to move on, to achieve recovery, to get back into work, to improve their well-being, to reduce self-harm, to reduce the risk of suicide. We need to be much more ambitious with individuals.
Okay, thank you very much.
Good. Thanks a lot.